LASIK has become really popular among people with presbyopia.
Hello, doctor.
Hello to you too.
Doctor, today I'd like to ask you some questions about presbyopia correction.
Yes.
Among them, there are many people curious about PresByond.
Correct.
Any are curious?
Yes.
The name sounds a bit difficult. What exactly is PresByond?
I think the name is probably a combination of words. Presbyopia is a medical term that refers to age-related farsightedness. It seems to be a combination of presbyopia and beyond, meaning going beyond presbyopia. So, PresByond isn't an academic term, it's actually a surgical method developed by Carl Zeiss using the Excimer laser system. In fact, PresByond requires a more detailed approach because unlike SMILE, which only corrects myopia and astigmatism, it cannot correct presbyopia that way. This method intentionally induces a slight amount of residual astigmatism, specifically something called spherical aberration, to achieve the effect. By creating a negative spherical aberration, we can slightly widen the depth of focus, which is a beneficial side effect. By applying this principle, PresByond is essentially a type of LASIK that not only corrects myopia and astigmatism, but also treats presbyopia at the same time. LASIK has become really popular among people with presbyopia. I also think it's a really great procedure. It is indeed a good procedure, but PresByond actually involves treating a bit of mixed astigmatism as well. It's a treatment that combines mixed astigmatism correction, deepening the depth of focus in both eyes to widen the range of clear vision, while setting one eye to focus more on near vision. Because it involves mixed astigmatism, there's a slight difference between the two eyes, so an adaptation period is needed. However, the advantage is that objects can appear noticeably clearer. One of the side effects that can occur with presbyopia cataract surgery using multifocal lenses such as night glare or halos. That doesn't happen with PresByond. So it can be a good option for those who are concerned about night driving or have difficulties with night vision.
For PresByond, the appropriate age range?
This procedure is not suitable for those who already have cataracts, and it is less effective for people with very advanced presbyopia. In my view, the ideal age range is from the early to mid-40s, or even from the late 30s if presbyopia symptoms appear early, up to the mid to late 50s, where noticeable results can still be achieved. At the same time, people who already have vision issues such as myopia, astigmatism, or hyperopia tend to feel more satisfied with the results. This is because PresByond not only corrects presbyopia, but also improves those existing refractive problems at once. So patients in their 40s or 50s who have long relied on glasses or especially contact lenses often experience a high level of satisfaction after the surgery.
Can presbyopia redevelop over time?
As mentioned earlier, presbyopia tends to get worse over time. For example, someone in their mid to late 40s may have had this surgery and see well, but by their mid to late 50s, near vision may naturally decline a bit. So, when early cataract changes begin, patients often opt for cataract surgery rather than PresByond. But for those in their early to mid 50s or late 40s without cataract changes, PresByond or Viva is more common.
After receiving PresByond, for more advanced presbyopia, patients may undergo PresByond again.
It can also be enhanced further. The approach may vary depending on the condition of the lens.
Cataracts are treated with cataract surgery.
Yes.
Vision is corrected through PresByond surgery.
Even patients who have had cataract surgery can undergo PresByond. In the past, multifocal intraocular lenses weren't as widely used. Also, quite a few patients opted for monofocal lenses because they were concerned about issues like glare or light halos. However, patients who had monofocal lenses often experienced difficulties with near vision. In such cases, PresByond can be performed to improve their near vision.
About the PresByond surgery.
What should be known before PresByond surgery?
PresByond surgery is a bit more delicate than the procedures performed on younger patients to correct nearsightedness or astigmatism. It's best performed by someone with a lot of expertise and experience. Not only do they need to accurately correct the basic refractive errors such as the amount of nearsightedness, astigmatism, or farsightedness, but they also must precisely align the visual axis during surgery. Only experienced surgeons, especially those with extensive LASIK experience, can achieve good results. This isn't a procedure where rough or careless work can still give excellent outcomes.
Vision for PresByond.
Yes.
What is the recovery period like?
The recovery period isn't very long. However, after LASIK, it's very important to be extremely careful during the first 24 hours to avoid any impact or trauma to the eyes. The LASIK flap needs at least a full day to properly adhere, so extra caution is necessary during this initial period. Therefore, compared to SMILE surgery, LASIK is somewhat more vulnerable to trauma. We often say that presbyopia treatment is the final frontier of refractive surgery. Even now, numerous techniques are being developed and continuously tested, but the truth is that no surgical procedure can be considered completely perfect. Nevertheless, as someone who has experienced the surgery myself, I can say the sense of happiness it brings is truly beyond words. That's because living with presbyopia can be quite inconvenient. Even if the results aren't a perfect 100%, there are now many promising methods being developed that can effectively replace the need for glasses or eye drops. So, I believe many patients can feel encouraged to take the step forward with confidence. So instead of giving up and just staying at home, feeling uncomfortable or complaining about the inconvenience, I want to encourage you to take that first step by visiting a clinic for an examination and consultation. Doing so could become a major turning point and help you live more comfortably and confidently. I'm saying this as both someone who has undergone the surgery and as a surgeon with extensive experience. Thank you.